Hi, my name is Henrik. Today I'm going to talk about the production cycle, which is the most crucial part of the OTH platform for processing patients in volume capacity. So let's log into the platform and let's see what this is all about. When you log into the platform as a nurse, you go into the actual patient group to which you are attached. And here you have your patients in your patient group who have submitted data, and you immediately see there are a number of different alert types. There is the red alert, which is a high acuity alert, which is one you need to respond to. So it is on the top of the list, which is the highest priority. There's the yellow one, which is a warning level alert. And then there's the blue one, which is a non-compliant alert. Non-compliance means that the patient or the citizen failed to submit the data according to the schedule that is inherent in the protocol in the patient pathway. So what we're going to do here today is to look at the data from Nancy Ann. And we press Nancy Ann, and then we go into the data and see that she has submitted blood pressure which was too high and the weight was way too high. And what we can do here is we can select which kind of acknowledgement we want to do, what is the closure note here, what is our intervention. So intervention here will be hospital admission, and we will send her a taxi and write okay to that. And then according to our protocol, we will then go outside of the system and perform the protocol's actions needed for bringing her to the hospital according to the protocol. So the patient pathway's purpose is to alert me as a nurse to the fact that the patient needs to be put to the hospital or needs to be react to the protocol. And now, as you can see, she has been downgraded to yellow warning, and now I've processed that and I can take the next one. This is the production cycle that enables us to have a high volume capacity for processing patients in the system. So now, having done that, I can process all the alerts on Nancy Ann, and what remains now to be done is actually just to write this up and then wait for her to submit further data from her home. On the patient part, the patient will be able to see a very simple menu. There's very few options for the patient to do, so there's not a lot of confusion about it. Starting from the bottom, there's a calendar showing the video conversations that has been planned with the patient. There is information and guidance, which is the actual transfer of knowledge to the patient, where the patient can be educated and look into videos and documents that gives instruction and information about how to operate equipment and how to perform the different activities they need to be informed about. Then there's the messages, where they can see what is written back and forth between the doctor and the patient. And this is a very crucial part. It's very important for the patient to be able to communicate with the doctors and nurses that are in charge of the patient group. But most importantly, the patient can activate the consultation list and go into the basic health check consultation, which is the one we want today. And they are welcomed, and then they perform the questionnaire. They start by getting prompted if they feel better than yesterday. In this case, they do not. And because of the answer no, we know that we will be asked about the symptoms. We are now prompted to do the weight, and the weight measurement is input. And the blood pressure is input as well. So now the process has been completed. The patient has submitted all the data that she measured and entered all the answers to the questions, and has now finished the process. Next time she has been scheduled to submit data, the tablet will alert her with the audio and visual notification, so she will be alerted to the fact that now it's time to do it again. But between now and then, there will be no residual data left on the tablet whatsoever. Everything is cleared out so she can safely put it away without worrying about private data. So now we're back in the call center, and Nancy Ann has submitted data. So what we will do now is go in and review the data that has been sent to us. And she has submitted some data which we'll see, and we can see there is a blood pressure here which is flagged and a weight that is too high. So we can see the data that has been submitted and review the last 30 days of data entries, and of course decide on what kind of closure notes, what kind of intervention needed to be done here. Since we have red alerts, we probably need to call the GP or something similar that takes care of these alerts that the Nancy Ann has seen. So we will make sure the GP is called. That's a part of the protocol. The nurse is obligated to do whatever the protocol states. And in this system, we just clear the intervention, react to the data, submit the closure note, and then we process the next patient. So doing that, as you can see here, we acknowledge it, and Nancy Ann is downgraded to gray. And we now have Nancy Ann away from the to-do list, and now we'll process Lisa next because she has the next high-level alert on the list. And as you can see, this is quite expedient process which allow a nurse to process 60 patients per hour, which means that we in ballpark figures, can have around 200 clinicians monitoring 100,000 patients, which gives us a huge capacity increase in a virtual call center. And mind you, this virtual call center does not have to be in the hospital. The nurses can be attached to a virtual team and work from home. If we have an epidemic or a pandemic like the COVID-19, we can mobilize people who are not in the hospital but in their homes and available to participate in working with monitoring patient data from home. Thanks.